My name is Brandon Marshall. I'm an assistant professor of epidemiology here at the Brown University School of Public Health. I did my PhD in epidemiology at the University of British Columbia in Vancouver, Canada, where I had the opportunity to be part of the scientific evaluation of Vancouver's Supervised Injection Facility. Myself and many others on the evaluation team have published dozens of studies now looking at the benefits and potential issues around opening SIF in neighborhoods where there's extensive injection drug use, overdose and HIV infection, and so on. And what we found essentially is that SIF help bring people out of the cold and into the healthcare system. We can offer a lot of information on how to inject properly, prevent the transmission of HIV and hepatitis C, and importantly, provide people with just basic interventions that can be used to prevent overdose. Once people are using the facility and engaging with the program there, public disorder actually decreased. We saw less injection-related litter, so it actually tends to improve the conditions in the immediate neighborhood when these facilities are opened. And we found no evidence of a honeypot effect and no evidence of increased injection drug use in the people we were studying. So we collected data from the coroner's office and mapped overdoses around in the downtown east side and around the facility both before and after the SIF was opened. And what we found was a 35% reduction in overdose mortality in that neighborhood after the facility opened. And that was compared to only a 9% reduction in the city of Vancouver overall. So what that showed is that the SIF was actually having an impact on reducing overdose mortality at the community level. There was a study of street-involved youth in Vancouver that were following people while Insight was opened, and we found no increases in initiating injection drug use after the facility was opened among youth. Other researchers at the University of Toronto looked to see whether the facility was saving taxpayer money. Was it costing a fortune without benefits? And what they found, because the facility is preventing new HIV infections, preventing hepatitis C infections, the facility is actually very cost-effective because it prevents those very harms. So again, many of the harms that lots of people, including us, were concerned about simply were not borne out. There's actually an addiction treatment center on the second and third floor of the facility, so it's actually co-located with the supervised injection. People using the facility were 30% more likely to enter into detox and other forms of addiction treatment, partly because of that close alliance between the harm reduction service and the addiction treatment facilities that were co-located. So when we think about these facilities, not only are they saving lives, preventing overdose, but they're also acting as a pathway to help engage people in healthcare and get them into various kinds of a treatment and help them lead lives of lifelong recovery. To date, there's been over 3 million injections at the SIF, and to date, not one person has died. So in the context of an accelerating opioid and overdose epidemic in the United States, this is an evidence-based intervention to look to try to address some of those harms and notably prevent overdoses in cities around the nation. Yeah, so this lovely poster I was able to get in San Diego just last week at the National Harm Reduction Conference. There's a lot of interest in SIF around the nation. Cities like New York, San Francisco, Boston are all looking to these interventions as ways to address the opioid crisis in their cities. So I think it's it's very exciting that we're starting to see that widespread support in lots of different communities for these interventions.